Okay, gonna do another video. This one a couple weeks ago. Anyways, if you're watching this, like, subscribe, all that fun stuff. But anyways, a couple weeks ago I had watched this video, and I did this video. It was in response to a video that I saw on this other channel. It was basically a borderline personality hate channel, and basically, it was supposedly mentally healthy men just bitching and complaining about their girlfriends or wives that supposedly had borderline personality disorder. And I'll probably do a couple videos on this because there's a couple things that I left out. Unfortunately, I just can't keep all my thoughts organized, so the only way that I'm going to be able to do this is to probably break it up and do certain sections. But when I did that video, it was about 20 minutes long, I think. And when I got done, I realized there was a few things that I left out that I wanted to cover. So I guess the second part that I would add to that is they had stated in the video, and first, just to reiterate, I think the name of the channel was shit. I don't even remember the name of the channel. It's on the other video, I think, that I mentioned it. I know the guy's name was Paul Elam, Elama, and then they had this doctor supposedly. They called her Dr. T. I thought, in my personal opinion, I thought the whole thing was unprofessional, and in my opinion, I thought if she's a psychologist, she was unprofessional. Anyways, the one thing they got talking about is, if you ever meet somebody with borderline personality disorder and they tell you that, they're in therapy, move on anyways because there's nothing that can help them. And that simply is not true. Prior to 2003, 2004, that may have been true. But now we have other things. This is my DBT book that I did take, and deals with like mindfulness and emotion regulation and distress tolerance and interpersonal relationships. But in addition to DBT, which is the most common, or probably the most well-known treatment for people with borderline personality disorder, it's dialectical behavior therapy, or DBT. There's that. There's also mentalization behavior therapy, or MBT, and then there's schema therapy. And so there is therapy for people with borderline personality. I live in a relatively large city. I've never encountered anybody that does the schema therapy or the MBT. And even the DBT can be difficult to find. It's becoming more common, but if you can find it, it's not uncommon to be placed on a waiting list. I had to be. And if you're in a smaller city, uh, it can, there's a good possibility that they may not have it. And you may have to travel to a larger city. But DBT has been shown to be roughly effective in about 60%, I think, success rate, somewhere around there. And basically, you know, how I look at things is, at least with me, and I assume it's like this with other people with borderline personality disorder, I can go back to my childhood and I can think of situations where I didn't have any control over things, and I was put in situations that uh, nobody who's in sixth, seventh, eighth grade should have been placed in. They didn't have the coping skills. I didn't have the tools to deal with those situations, and I had no control to get out of it. It's not like I could pack up and leave and get a job and get an apartment at 12, 13, 14 years old. So I think in those situations, at least with me, there's not a real chance to form healthy behaviors. And so bad behaviors develop over time. And so if anybody thinks that going to DBT or any one of the other therapies is going to solve anything overnight, that's simply not true. Basically, DBT teaches how to control emotions and naming emotions and distress tolerance and interpersonal relationships. And a lot of times it's homework. The more you practice it, the more you're going to get out of it. It's not something you can go through and it's going to fix you or cure you. It's a matter of going to the classes and working on these coping techniques and making them a part of your life and getting them to the point that it's integrated into your life to where you don't have to think about it. And the thing with DBT, the really interesting thing about this is a lot of times it's not just one skill, but there's several skills involved, for coping techniques. Coping ahead is a great strategy, and with coping ahead, which is a strategy, from there you might have, it's basically putting a plan in place. So one part of DBT would be you're coping ahead. Another part would be, okay, you're coping ahead. What can you do when you face the distress? So you're learning distress tolerance skills. So you're putting in that. And so basically it's these skills build upon one another. And I guess the other false thing that was in this video these people did is that I think it was mentioned that insurance companies cover that. And that's false in a lot of cases. A lot of insurance companies don't cover that, and it's not cheap. I did just the group therapy, which meant once a week for a year, and that ended up costing $2,400. And had I done, the group therapy plus had a DBT therapist plus had the on-call service, it would have been over that. So that's the other part that I wanted to have. If you're in a relationship with somebody that has borderline personality disorder, they really need to be in a program like DBT or schema therapy or mentalization behavior therapy, because if you get into a relationship with somebody with borderline personality, you're not a savior. You're not going to fix them. You're not going to make them better. They needed therapy, and a good thing for the significant other is for them to read up and be familiar with it so they can help out. And there's a good website. It's called dbtselfhelp.com, I believe. I'll put it down in the notes because you kind of need to be aware of what the program is, what it consists of, and you may have to help that person through that. Anyways, that basically covered the control portion that I wanted to get into, or the therapy aspect of it. And so I guess that would be this is kind of the second video of that. And then I'll probably do a third video about trying to maintain relationships. That would be another one that I intend on getting to at some point, but do these for right now. Hopefully I'll have the energy to do another one in the not too distant future. Like, subscribe, share the channel, help it to grow. Hope something to make success this year. Check out my poetry. There's a lot of new stuff on there. It's poetry.com/darksidewritings. So if you made it this far, thanks for watching. Thanks. Bye.